So hepatitis B vaccine now is a part of the universal childhood vaccination. Hepatitis C is the commonest cause of the transfusion transmitted hepatitis, and hepatitis E cause a very high mortality in the pregnant women because of the fulminant hepatitis is what you have to basically remember. Which is that antihypertensive contraindicated in pregnancy? All of you know ACE inhibitors are the ones which are contraindicated. Some of the questions I will leave for you to answer because we need to finish all the questions. So, which of these least predisposes to the infective endocarditis? All of you know that ASD has got a very low pressure difference between the two atria. So, that is the reason the least chance is for the ASD is what you need to remember. A 60-year-old superior mediastinal widening is there. This question is for Sale. Please answer this. Please punch your answer, doctor. Snowbervani thinks D. Okay. No. I think, please mention the question number. Question number. Yeah. So, very good. Ritu Raj identifies it as dissection of aorta. Absolutely right. Absolutely right. Now, a patient who is allergic to penicillin can be prescribed with which of these drugs as a prophylaxis of acute rheumatic fever? Please punch your answer. What is your choice for question number 10? Question number 10. Very happy to see 88 online students today. Question number 10. Very good. So, excellent. As rightly said by Rituraj, erythromycin is the one which is preferred whenever there is any penicillin sensitivity, allergic. If the patient is allergic, is what you need to remember. QT interval typically prolonged in hypocalcemia and shortened in hypercalcemia is a favorite question of the examiner. Where do you see differential cyanosis? Once more, this question is for a bet for you to punch your possible, probable, definitive answer. Please punch your answer for question number 12. 12 for Sale. Very good. Dawn proposes PDA with pulmonary arterial hypertension. And Hirani thinks VSD. No, VSD. Monica Sharma thinks tetralogy of Fallow. Please don't break my heart, Monica. Do wrong, but not too wrong. So, Karthik Kancharla absolutely says PDA with pulmonary arterial hypertension. So, what is meant by differential cyanosis? Earlier also we discussed many times this important point. So, you are having the ascending aorta, descending aorta, and arch of aorta. Then the pulmonary artery is present, and it is passing a duct between the descending aorta and the pulmonary artery. So, normal course may the blood in the higher pressure zone will obviously pass into the lower pressure zone. So, the hypoxic blood in the pulmonary artery and the oxygenated blood in the aorta, that will pass from aorta into pulmonary artery, normal course in the ductus arteriosus. The moment pulmonary artery develops hypertension, pulmonary hypertension, then the pressure in the pulmonary artery becomes higher and the hypoxic blood will reverse and then mixes with the good blood, the oxygenated blood. Because of that, there is a development of the cyanosis. But why only the cyanosis in the lower limbs but not in the upper limbs? Because the subclavian artery originates from the aorta, proximal to the point where the ductus arteriosus is entering into the aorta. So that is the reason all this deoxygenated blood mixes with the oxygenated blood goes to the lower limb, whereas the upper limb is not affected because subclavian artery originates before, proximal to the opening of the ductus arteriosus. So that is the reason whenever there is a PDA, only PDA, it is not a cyanotic heart disease. Why? Because PDA is predominantly a left to right shunt. So whenever it is a left to right oxygenated mixing with deoxygenated, there is no ASD, VSD, PDA, they are all basically the acyanotic conditions. The moment pulmonary hypertension develops, it's called Eisenmenger. The pulmonary blood flow will mix with the deoxygenated pulmonary arterial blood mixes with the oxygenated blood of the aorta. Then there is a development of the cyanosis, but it only affects the lower limb because the upper limb blood flow is originating proximal to the opening of the PDA is what you have to basically remember. So this is one favorite question repeatedly asked in the all exams which you have to be very sure about. So doctor, so totally if you take the last 15 years of AIMS, PGI, All India, NEET PG and JIPMER question banks and DNB question banks, hardly there will be around 20,000 points that you need to master. Out of them, 3,000 to 4,000 will be logical issues like this. The moment you master these 20,000 issues, any exam, let them give images, let them give videos, let them give anything, you will be able to win the exam. That is the whole idea of our everyday evening 5 to 8 p.m. session, free session on YouTube, all the 365 days. Tell your friends that some of the most beautiful things in the world are supposed to be free. Love is free. Marriage is supposed to be free. Coaching, knowledge is supposed to be free. And whenever possible, to treat the patient should be free. So that is how you should look at. So PDA with pulmonary artery hypertension is differential cyanosis. Wilson May, simplest question. Ceruloplasmin decreases, doesn't increase. H. pylori eradication may, what do we use in the triple therapy? Amoxicillin, bismuth subsalicylate and tetracycline are the ones which we typically use in the triple therapy. A 45-year-old with dysphagia, anemia, koilonychia, spoon-shaped nails, even in coma also you will answer it as Plummer-Vinson syndrome. Patterson-Kelly-Brown syndrome is what need to be remembered. You want to consider chest tube insertion. Now, please punch your answers for these questions. For this question, doctor. Question 21 for sale. Please punch your answer. You want to put a chest tube insertion. What are the indications of the chest tube insertion and which is not an indication except about this? Question number 21. So, please punch. Akshay Chugh proposes A. Don thinks it is C. Gracelyn Vinyl also thinks C, so also Rituraj. Beautiful. So when you see your own classmates fatafat answering the questions, you should get that high spirit that yeah, I too can answer because they are also answering. With that spirit, you have to pick up few topics to finish today. After this session is over, that is how you get benefited by regularly, perseverantly participating in this live discussions. So pleural effusion more than 10 millimeter thickness of on decubitus is the one which enable you to put a chest tube. So loculated pleural fluid with pH less than 7.2, pleural fluid glucose less than 60, LDH more than 1000 and a positive gram stain on the culture, they are all considered to be the important indications of the chest tube is what you have to basically remember.